day everyone, I am Lecobu-an of PSN 2G Group 3 and today I will be performing a bag technique. So what is a bag technique? A bag technique is a tool making use of our public health bag in which nurses or student nurses use when doing a home visitation. This enables us to provide care and nursing procedures to our client in which we can save time and effort when we are rendering nursing care. So here we have our CHN bag, and these are the contents of our CHN bag. First, we have our paper lining, plastic lining, our apron, hand towels, soap dish, wet and dry cotton balls. We also have our alcohol, our non-sterile gauze, our gauze bandages, and antiseptic spray, band-aids, sterile gloves, disposable syringes, our pen lights, digital thermometer, our stethoscope, betadine solution, our leucoplast and micropore plasters, and also our tuning fork. And lastly, we have our sphygmomanometer. So the first thing we need to do is to assess the completeness, neatness, and availability of the bag as well as proper arrangement. Next is we have to determine the needs of our client on the basis of home visit. Next thing we need to do is to gather all equipment needed such as our CHN bag and baby apparatus that is carried separately. After that, we have to identify the client and also explain the procedure. Good day, sir. I am Lecobu-an, a student nurse from Iloilo Doctors College, and I am here to perform a bag technique and as well as to get your vital signs. Would that be okay?
Yeah.
So your name, sir?
I am Lecobu-an.
So after presenting and identifying your client, we have to give our client some privacy. We will give our client privacy in order to promote safety and security to the client. So sir, I will be closing the door. Upon arriving to the client's home, we have to look for a flat surface or a table where we are going to place our paper lining in order to put our bag. So first, we have to get our paper lining. So in placing our paper lining, we have to make sure that the clean part is out and the folded part is touching the table. Next is we have to put our CHN bag on the top of the paper lining and make sure to tuck in the handles of our CHN bag. So the next thing we have to do is to ask our client for a basin of clean water. So sir, can I have a basin of clean water?
Yes.
So this clean basin of water is going to be put outside the working area. So the next thing we need to do is to place a plastic lining on the top of our paper lining. Make sure that the clean part is out and the folded part is touching the paper lining. This is done in order to maintain a clean working area and also to prevent contamination on our working area. So the next thing we need to do is to take out our soap and hand towels and apron. Make sure to close our bag to prevent contamination and do hand washing. So after doing our hand washing, we have to put on our apron. So in putting on our apron, we have to make sure that the wrong side is touching the body and the right side is out. So we have to make sure to tie the apron tightly. So the apron is used to protect the nurse's uniform and also an additional protection to the nurses while providing care to the client. So after putting on our apron, the next thing we have to do is to take out all the equipments needed on providing care to our client. We have to also make sure to close our bag to prevent the spread of microorganisms and in order to not contaminate inside of the bag. So the next thing we have to do is to put our waste receptacle outside of the working area. So next is we are going to proceed on providing care to our client. So what I'm going to perform today is taking the vital signs of the client. So the first thing I need to do is to sanitize my hands and equipments that will be used. So the first thing I need to do is to get the blood pressure of my client. Next is I will be taking my patient's temperature. Make sure to sanitize our digital thermometer before putting it to the client.
So while I was waiting for the client's temperature, I also checked the client's respiratory rate.
Next is I'm going to take the patient's pulse rate. So after that, I will going to sanitize all the equipments that is used. And place it inside the bag. Again, make sure to close the bag. And make sure to throw our waste. And ask the client to throw away the things that we have used, the waste. So the next thing we need to do is to do a hand washing. This is done in order to protect ourselves from contamination, especially that we have performed a nursing care to our client. So after doing our hand washing, we have to make sure to take off our apron. So in taking off our apron, we have to make sure to take it off away from the body, and also make sure that the spoiled part or the dirty part is in and the clean part is out. So fold it away from the body. And place it inside the bag. Next thing we need to do is to fold our plastic lining. So in folding our plastic lining, we have to make sure that the top part is in. Fold it and place it inside the bag. Close the bag. Next is we're going to pick up our bag and other equipments. Next thing we're going to do is to fold our paper lining. So in folding our paper lining, we have to make sure that the part that is touching the table is in and the clean part is out. The next thing we are going to do is to place it inside the bag. So after doing all of the procedures, we have to make sure to document the data that we gathered earlier. So sir, your blood pressure is 117/80. Your temperature is 36.5. Your respiratory rate is 18. And your pulse rate is 95. So after that, let us give teachings to the client. So sir, today we have a pandemic, so make sure to drink a lot of water. Make sure to put on your mask when you go out and sanitize your hands. Next is we're going to give appointments to our client. So sir, I will be back again next week, same time, 2 p.m. Would that be okay?
Yes.
And that is all for our bag technique.